But I think that's where I sort of land, which is to say, okay, absent, conclusive evidence one way or the other, a lot of this, until that moment arrives, what we can and should do is inform patients of the potential benefits and the potential risks of these exams. And if they...
Well, it's hard to know that until the research has been done, the longitudinal research.
No, I mean, I think we've just spent the last hour talking about some of the potential benefits and the potential risks, right? So I think...
But potential is kind of a cloudy term here because we don't know what the long-term data would show.
Well, I think on the benefit side is potential early diagnosis and better outcomes. I think the counterpoint would be potential overdiagnosis and or false positives or treatment or something like this. I mean, I don't think you'll ever get more precise a discussion than that. And I think...
But it's so important to figure out which way the scale goes, right? Because if you just tell a patient, well, like, look, we could be over-testing you, or we could be catching things early. Both are valuable, right? Like in terms of you want to not over-test and you also want to catch things early. But which way is the bar graph higher, I guess? Are you finding more things early and are intervening and prolonging life? Or are you catching a lot of things prematurely, perhaps over-testing and causing harm? Until that's
No, I get that.
Yeah.
But then, well, maybe I'll finish the sentence for you. Until that's elucidated, do we think it's the practitioner that should be making that decision on behalf of the patient? Or do we think that we should do our best to inform the patient and allow them to make a decision?
I think it should be a shared decision-making approach, which is kind of where we land with a lot of these screening protocols. I mean, the PSA is a prime example of something that we used to recommend, and now it's in the shared decision-making approach. When a patient approaches me as to whether or not they should get scanned, it's based on their case, what's going on with them, what their mindset is like, what their family history is like. But it's hard to universally say that everyone should get it.